Okay, so welcome, guys.
Thank you.
Thank you.
But sit there so that your cameras, your face is in the camera, please. Go ahead, please.
Now, hi everyone. As Linda just introduced us, I'm Shreya.
Yeah, I'm
Probably
Ananya.
remember.
And I'm Soumya.
And today we're just going to be kind of going over emergency preparedness. So kind of what to do and when to call 911 and whatnot. And then also a little bit about fall prevention. Yeah. Should I just scroll?
Yeah. Okay, so some signs and symptoms that might warrant a call, which you guys know, would be shortness of breath, chest pain, falls, and strokes, especially because shortness of breath and chest pain could be related to like a cardiac event, which some of you guys might have experienced, and especially falls because like even if you might not feel anything, it might be masked under something, so you might want to call for that, and stroke symptoms especially as well. And then we have like a picture here that kind of shows like when to call versus when not to call. And again, kind of differences in like what you might see, like your baseline versus not, especially mentally, in terms of like stroke and then chest pain, dyspnea, that kind of stuff. And then mild symptoms and COVID testing, you shouldn't call because that you can take care of on your own with like a phone call, or it's not as acute as what 911 might be warranted for. So some information you might want to include when you call is location, and that's not just your address. So like if we were calling for here, we would say like Folsom Hall, 7667 Folsom Boulevard, and then we would also include like 3rd floor, Folsom Hall, the cardiovascular wellness program room, so that they know exactly where to come and get you. So you want to include where you are. So if you're in the living room, you want to say, hey, I'm in the living room. That's like down the hallway, exactly where you are in your building as well. And then you also want to tell them who the patient is. So you're calling for like maybe your wife, or you're calling for yourself and you're like, I'm a 26-year-old female. I'm 19, but I don't know why I said that. But you want to tell them who you are. And then if it's someone else and you know that like their level of alertness is something different from their baseline, so if they look more confused, so that you're telling them maybe it might be a stroke or it might be hypoglycemia, you want to let them know so that they know what to prepare in the ambulance, or especially if they're unresponsive. So if you can't get them to wake up, that is something that is extremely important. And that'll also make them like drive code 3, so they'll come to you faster. So when you call 911, it's not just that they'll come with their lights and sirens on every time. It's kind of based on like what you let them know. And then this goes directly into signs and symptoms. So what are you seeing? Is it like a broken bone? Are they not waking up? Are they just acting weird? You want to let them know that. And then the last point, it's not as important, but like, if it's like they've had a stroke before, that would kind of clue in the EMT or paramedic. So that might be something important, but that's also something you could tell them once they
arrive. All right, so when you call 911, there's a variety of like levels of care of whoever can arrive in the ambulance. Most often when we think of like 911 and like the lights and sirens, usually those will be paramedics. And if you like see a fire department pulling up to the almost like most of the firefighters are paramedics. But sometimes you can also get EMTs, like the 3 of us, or in more rare cases or situations, CCN or critical care nurses. But those are for slightly different situations, which I will get into. But just starting off with EMTs or emergency medical technicians, this is kind of like your first level of immediate care and transport. The EMT's scope of practice is less than like, say, a paramedic or a nurse. But typically EMTs will start off with like interfacility transports. So they may not always like come to like a residence, say when you call 911. But maybe we're going from like a hospital to a hospital, or transporting patients like once they've been discharged from a hospital back to home. But yeah, so you may not always see EMTs if you call 911 like from a residence or from a different location. But essentially some of the main things as EMTs that we do are like monitor vitals in the back of the ambulance, and administer O2 if they're on like a nasal cannula, or like need any higher levels of oxygen. And yeah, a lot of interfacility transports between like hospitals and dialysis centers, discharges to residences and things like that. But going one level up to paramedics, who you'll most likely see if you end up calling 911. So yeah, like I mentioned earlier, they are more highly trained than EMTs, and they can perform more complex procedures, such as inserting IV lines if like the patient is dehydrated. They can do a lot more cardiac monitoring, so they can set up an EKG and read EKGs. And then the medications that they can administer too is a much bigger scope compared to an EMT. So like medications through the IV, or also just orally if the patient can tolerate that. But yeah, so typically with 911 calls, it will either be a paramedic partnered with an EMT, or sometimes in some cases like the fire department, you might get multiple paramedics, just depending on the situation. And then this is probably like the least common. When we talk about like critical care transport, it's usually from hospital to hospital. Like if a hospital is unable to provide certain specialized services and the patient has to be transferred to like a more like higher level hospital or whatnot, that is when you'll typically see like a critical care nurse helping with these transports. And yeah, sometimes these critical care rigs might look a little bigger, just due to extra equipment, IV lines, different types of oxygen tanks and whatnot. So yeah, but these you would probably not see if you call 911, most likely paramedics, or a paramedic paired with an EMT.
So, what they will ask you when they first come in is samples. So that's something that we learned in school, that this is like the first thing that you would ask on like a medical aid, obviously not on a car crash, but here you would ask like for signs and symptoms. So it would not only be like what we're seeing, we would obviously judge what we're seeing, but we want to know if there was anything else that we missed or that stopped that was earlier. So maybe if they had a seizure, then that would be like a sign that we missed because we just weren't present for that. And the next thing is allergies, because like Shreya said, the paramedic can give a whole bunch of medications, and so this is something that they would want to document. So obviously they wouldn't want to give you a medication that you're allergic to. So if you have like an aversion to like ibuprofen, they would obviously not want to give you that. And then the next one is medications, because EMTs can help you out with your medication. So if you say you have shortness of breath, and you're like prescribed albuterol, even though we can't give you albuterol on our own, we can help you with your inhaler. So we would ask you if you have any medications that we could help you with, or if you're a paramedic, they would like document that so the hospital knows later. And then past medical history. This one is probably the most important one, apart from signs and symptoms, just so that like if you had a previous cardiac event or STEMI earlier, we would like be more clued in that maybe that might be something that's going on, or it might be something like a stroke that you might have had earlier. So we really want to know your past medical history, especially the big things like stroke, diabetes, STEMIs, and seizures. Those are the 4 big ones that we want to know about. And then the last one is last oral intake, and this is especially important for diabetics, so that we want to know if you guys took your insulin, did you eat after that? Did you not take your insulin? What might be going on? And then the last one is events prior. So if it's something like a heat stroke, maybe you would like say, oh, I was out, or they were out for like 4 hours in the blazing sun, and that's what's going on. One thing that we really found on our like ride-alongs or while she was working was something really helpful to have ready is a hospital bag, especially because even if it's not something acute, something that needs to be fixed right away, if you're not in the room for a while, you could be in the waiting room for a while. So it's good to have all of this ready. Starting with the list of your medications, the EMTs might ask for it, or it might be when you get to the hospital, they'll ask for it, but having that on hand, ready to go to give to them, or just for you to have as well in case you forget to list something, is something very important to have. A change of clothes, that's just for comfort, especially because I've heard horror stories of like people spending 5 nights in the ER without having a bed. And you know, that stuff happens a lot nowadays, especially. So that might be something nice to have. Your medications, again, if you're there for like 5 nights, you're gonna want to have your food and medicines for all of that. So I would even recommend taking like a week's worth of medicines at least, even if you like can just buy food there. And your phone, obviously, to contact family, contact nurses who might call you, your doctor might be at another hospital, might want to call you. And with that goes a portable charger. I don't know if any of you guys have those or many of you do, but just to have that charged and ready in your bag would be great. Again, if you're there for a couple days, they might not have an outlet, there might not be space. So to have all of that with you so that you have your phone ready for anyone who needs to contact you, because nowadays our phones are our lifelines, is so important. And to go with that, like food. So having this ready at home, I know we have a couple like ready at home is awesome to have in cases of emergencies.
Okay, so now just going a little bit into cardiac arrest, and specifically, we're just going to talk a little bit about AEDs, just because this does come up often, and yeah, I guess AEDs. So I'm sure you guys have all know about this, and like there have been many talks about this before, but essentially, when talking about cardiac arrest, we mean that the heart isn't pumping blood to the body, and like you're unable to find a pulse, either like the radial or more probably like a carotid pulse, and usually they're not breathing as well. And in this case, yeah, so in this case, once you notice those, the first thing you would do is call 911, and like Soumya mentioned, like all the list of things you would tell 911, just like the address, who you are, or how old you are, or if you're not the patient, somebody else, and with all that information. So the first thing you would do is call 911, because even though we do have lights and sirens and can use them, just because we do doesn't always mean we can get there in like a minute or two. Sometimes it can take up to easily 5 or 10 minutes. So by calling 911 and letting dispatch know that you do need help, they will send somebody on the way, and then you can go ahead with the next steps.
Quick question.
Oh, yes.
Were you maybe about almost a couple years ago, my next door neighbor, she came next door, way early in the morning to say, if I could, she needed help. Her husband, he was diabetic, he had something going on. But I guess if you were to expand on your comment about sirens or whatever, because it was in the neighborhood, they don't put the sirens on, do they? Because I kept waiting to hear something, and I guess they have lights on, obviously, but not siren, because I was getting really nervous, because I'm not the person you want to have around in an emergency, because I get all panicked. So my question is, if it's the wee hours, I assume that must be standard, that there's no sirens, just lights as they
Yeah.
are on their way.
Yeah, that's kind of up to the driver's discretion. Especially because you would want those sirens if there's traffic around you and you need them to move. If there's no one there, it's the wee hours, it's a residential neighborhood, and they're able to go the speed that they need to without having that on and disturbing the surroundings, they're not going to do that. So lights and sirens is based on like situational. It's only used if it can get you there faster. If you can get there just as fast without disrupting all of the houses around and like ruining their sleep, they're not going to do that. So that is a good point. Like you might not expect it, but they will be there.
Okay, thank you.
Yeah, that was a good question too. I know when I like started training and working as an EMT too, like the EMTs that I started working with originally even told me that sometimes the sirens may not always be helpful, and they can actually sometimes just cause more confusion in traffic, especially if people don't always see where the ambulance is coming from. But yeah, as Ananya mentioned too, in like residential areas and like closer to hospitals, if it's not helpful, we try to turn the sirens off, just because if there's like tons of patients around or like a residential area with people sleeping and going about their own day, we try not to like always have the sirens on because they can be pretty loud. But yeah, it's a good question. Yeah, so just going back to the steps after calling 911, you would just check again to see if they're responsive. You can like tap them on their shoulder, say their name a couple of times, to see if they're conscious or if they're unconscious and whatnot. And if there are multiple people around, it's best to like delegate, so you can tell someone, hey, can you go look for an AED while you start CPR? And we also wanted to touch on this topic of AEDs, just because as EMTs and like paramedics and everybody in the emergency services field are like, we're trained on how to use them, but we also would just kind of want to make it clear that even if you have no idea how you think you would be confused while using an AED or difficult, usually that's not the case. They're in public locations, and when you do open up an AED, there you just turn the on button on, or press the button on to turn it on, and then there's usually like a verbal like script or audio that plays, and that tells you like exactly what to do step by step. I remember even in my EMT school, before they taught us how to actually use it, they told us just to take it and put it on a dummy and learn how to use it that way. And it was pretty straightforward in terms of you just turn it on and it will tell you like step by step slowly exactly what to do, and like what to do, the steps to follow basically. So even if you think you might be lost or confused, and I know it can be a stressful event when you're calling 911 and all that, usually the AEDs are pretty straightforward and easy to use, and can be life-saving. But yeah, if there are multiple people, it's easier to delegate. Just go say, hey, can you go look for an AED? And yeah, especially in public locations, grocery stores, obviously near hospitals and whatnot, they are should be easily locatable or like findable with like the bright red AED like labels and colors around it.
I suspect that, I think there's an app out there that says find the nearest AED.
Oh, there are.
I'm sure there are, yeah.
Yeah, I think I have seen a couple with like maps for the closest AED.
Yeah.
If it's like registered.
There is a map at Sac State that shows where they're all over campus.
Mhm. Yeah.
But people aren't gonna have it in their living room.
Yeah.
Yeah, maybe not in residential areas, but yeah, and like in pretty big like university campuses and things like that. And sometimes they can be found like close by, like near fire extinguishers and things where other like emergency equipment would be. But yeah, not too difficult to use, just follow the instructions.
And then again, in cases of an emergency, a lot of us will get like an adrenaline rush and like try and run to like save them or anything. But remember, in any emergency or any situation, your safety is your number one priority. And if you feel unsafe to do it, like say you have like an arm injury or something and you think that like CPR might hurt you, or like there might be like a couple dogs who might be aggressive and might hurt you, like your safety is number one priority. If you feel unsafe in any situation, don't get into it, especially because you don't want to hurt yourself, and for us, we don't want additional patients.
Yeah, I remember my like EMT officer who I first worked with said, you know, we only have one bed in the ambulance, so if somebody else gets hurt and we've only sent one ambulance, we're gonna have to send another one. We don't have room. So yeah, the first thing is always seeing safety and make sure everything is safe, and you are also like looking out for your own safety before approaching any situation like that. Yeah. Yeah, so if you've sent someone to go get an AED and if there's multiple people around, that would be best. In that case, since somebody else could start CPR if the patient isn't breathing and doesn't have a pulse. But as it says in all caps, your safety is the priority. Do you wanna say-
We've done this a couple years ago. We gave like a small talk on like fall prevention and just wanted to review that, especially because this is like one of the most common things that we get called to are like falls in like an elderly person at home or in a nursing home. So ways to prevent that and how to like get up and try and get the help if you do fall, is what we're gonna go over really quick. So these are the main causes in falls, and honestly, the causes are less important than how to prevent it and how to get up once that's happened. So here's a quick slide about statistics. I'm sure all of you guys are familiar with it. So the one thing, the like biggest issue with falls is probably a hip fracture, just because they can cause a lot of internal hemorrhage and they take forever to heal from, and have like even a 21% mortality rate after like they've been diagnosed. You're receiving treatment. There's still a huge risk. So this is just a quick one on how you might be able to prevent a fall. So focus on like building strength in your legs and improving your balance. And I'm sure you do a lot of that because you come here. I know Linda has amazing strength classes and you have all these machines. So I'm sure all of you guys are doing an amazing job at that. But the next thing is just be aware of fall hazards. So this is something that like when I was on my ride-alongs, I was talking to a bunch of the paramedics because we were surrounded by like 3 nursing homes, and they said the biggest issue that we have is fall hazards, and the biggest one is carpet corners and wet bathrooms. So 2 a.m., like they will get someone who has slipped in the bathroom because it is just wet. So you want to make sure that you're ventilating that area, keeping the floor dry so that you don't slip. Maybe grippy socks at home, carpet corners, ropes, scraps, slippery stuff. So you just want to keep that away. And make sure that your walkways are well lit. So maybe there might be like a cord on the floor. You want to make sure that you're able to step over that. And the last one is that your mind might be faster than your legs. So you want to take a second. So if you stand up, don't immediately run. Just take a second, take a deep breath, maybe count to 5, and then keep on. So, once you fall, obviously, if there aren't major emergencies, this is like a good way to get up so that you don't injure yourself further while trying to stand up or lose balance. So this is like a pretty slow process getting up, and there's no need to go faster than you can. So Ananya can talk a little bit more.
Yeah, so we found this graphic. It seemed really helpful. Again, if you think that doing any of these steps will hurt you further, don't try and find someone to call 911. If you have like an emergency button, use that as well. This is just to minimize it, and then if you have the ability, try again. But yeah. That's all we have for today. Do you have any questions?
Well, one question I have is, since I've been in the hospital a few times, they don't want you to bring your medicine to you. They want a list, but they don't want you to bring any medicine.
Yeah. I don't think they want you to take your medicines if they're giving you theirs.
Yeah.
But like this is just in case you're in the waiting room for 5 days. Like that was like kind of the concern there. If you're taken care of and they're giving you the treatment that you need, then you shouldn't take yours. But in case you're just sitting there, It's for situations like that.
Yeah.
And if I fall, all I have to do is call Jane.
That's a good
If
system.
you're having trouble getting around, going to the bathroom or just getting up and going wherever, you should be using a cane.
What happens when Jane falls though?
Well,
Cane falls.
I have to think about that.
So FYI, September is Fall Prevention Awareness Month, so we'll be doing a lot more stuff on fall.
Would you address the post and having it posted?
Sorry, the what?
The post.
The DNR. Oh, yeah. So, with that, you definitely want to keep that ready if that's something that you do have, because we can't, stop treatment until we see that, and it has to be signed. That's the biggest thing. So even if you just have the document, it has to be signed by you and your physician, and it has to be completely filled out, and that would be something that we need to see and verify before we stop. So you want to keep that.
So as an EMT, you're trained to look for that.
We are
Yes.
trained to look for that, and it has to be completely filled out. We were taught that it also has to be the original copy. We can't have like a copy of it. If you have the original documents, have that on you. And again, if you want to like go through your paperwork, make sure everything's filled out, because if there are any holes, we're legally obligated to continue with our full scope of care.
Yes, I think when I was working with the paramedic once, he said a lot of some of the patients that he treated often put up like the post, like the bright pink form on like a refrigerator or somewhere like an obvious location in the house. That way, if they do enter and do see it, they know they can follow the instructions on that. But yeah, a good point also that Ananya mentioned is it cannot be a copy of it. It has to be the original document.
Do you have a question? Susan?
I just had a question about, using a walker. Are there special things to keep in mind if you want to use a walker?
It would be mostly like the same thing as like regular hazards. I've heard of a lot of people getting stuck on like carpet corners. That was the biggest issue. Like carpet corners or ropes, so you want to be aware of that. And that was like the biggest thing. So I'd say it's like the same level as like if you were without a walker, you still want to keep your walkways clear and everything. And that also goes straight into like it being a well-lit area to walk in. Because even if you have a walker, you want to make sure that the walker can go forward too with you. So just make sure that you can see if there are any other hazards.
I'd also add, walkers set the brake
Yes.
when you walk away, because when you come back to it, if you're falling, it's going to be.
That's right.
That is a good point.
And then I'm curious, how do they know what hospital to go to?
They'll ask you. Okay.
The EMTs or the dispatcher?
So, dispatch will tell us, or if they're like experienced, they'll know what the closest area is to take you. In the area, UC Davis is the only level 1 trauma center, so if it's something big, probably UC Davis. If it's something acute, we would ask you, because like, if it's like hypoglycemia and like as EMTs, we gave you like glucose on the scene and you still want to go, that's a less acute situation and like we're okay driving you 30 minutes. So we'd ask you at that point, what hospital would you like to go to with your insurance? Yeah.
And you may not be able to answer this question, but many people are reluctant to call 911. They don't want to pay for an ambulance ride.
Yeah.
Yeah,
So they're not always 100% covered by people's insurance, right? So
How
where
you
does that come up?
get around that?
Yeah, I think they have case managers for that, like in terms of like the hospital and when you get there. Obviously, if you need it, don't hesitate to call. And then, a lot of times, like we've also seen like the other hand of it, like people call 911 because they think that for the same situation, if you go in an ambulance, you'll get your care faster. That's not necessarily the case. It's based off of your symptoms. It doesn't matter how you got there. So you could still be in the waiting room for a couple of days. So if you need 911, don't hesitate to call. Because there are like legal systems in place to help you with the costs when that becomes an issue. But your health is a priority.
And we've had situations where people, where we call 911, and if they don't end up taking you, then the patient becomes financially liable for
Mhm.
emergency visit from the fire department, whoever, because they can't get any money for insurance company because they weren't actually taken by the ambulance.
Yeah.
So that was a learning lesson for us. Again, it goes speaks back to these people will like to call because they can only call if they know they really need to go.
Yeah.
It's kind of how I think.
That's also
That's
like a
true.
county issue, because
Huh?
I know that's also like a county issue, because I know in like other places they don't charge you unless they take you.
Well,
So
this county will charge you unless they take you.
yeah.
And then they'll charge you there,
Oh,
so.
wow.
Yeah.
I think it's like a $250 first responder fee, but then a $2,000 transport.
It was $400
Oh, for the first.
for not going.
Yeah, it's like department specific, so I was like talking to like Elk Grove, they said it was $250, but maybe over here it's 400, but.
Well, thank you guys. That's great.
Thank you.
Thank you
Thank
for
you.
giving us the opportunity.
Yeah.
Thank you.
So are you gonna keep working as ENT while you're in school?
That's the plan.
And Shreya already has a job,
Mhm.
and you guys probably don't because you're
No.
not where you go to school. Yeah.
Yeah. We also just got certified, like Shreya's been certified for a year, so she has like much more experience.
Did she
Not
tell
much
me
more
she's
better.
gonna drive in the ambulance?
Mhm.
Her driving the ambulance.